Hi, my name is Dr. Sonali Patel. I am a PGY3 at the University of Cincinnati, and I wanted to present a unique case of unilateral microphthalmia and coloboma syndrome associated with a novel variant in the SOX2 gene. I wanted to say a very big thank you to my mentors, Dr. Dolezal and Dr. Utz, and also another very big thank you to our wonderful geneticists at the University of Cincinnati's Children's Hospital, Dr. Slatvinek and Dr. Brightman. The purpose of this case report was to discuss the presentation, evaluation, and treatment of an infant with unilateral microphthalmia, iris, and optic nerve coloboma who was found to have a novel, likely pathogenic variant in the SOX2 gene. Our patient was a 5-week-old female who presented with unilateral microphthalmia and on exam was found to have iris and optic nerve coloboma in the right eye. The patient's family history was significant for bilateral congenital and developmental cataracts in the mom, maternal grandmother, and great-grandmother. The patient's maternal great-grandmother had bilateral iris colobomas and cataracts. Genetic evaluation revealed a heterozygous, likely pathogenic novel variant in the SOX2 gene. Both parents tested negative for this novel SOX2 variant, and that variant was de novo in this patient. Some background is that SOX2 associated disorders are inherited in autosomal dominant manners and have highly variable systemic and ocular phenotypes. Typical ocular manifestations include anophthalmia, microphthalmia, colobomas of the iris, retina, and the optic nerve, and optic nerve hypoplasia. Systemic features include CNS malformations, pituitary dysfunction, developmental delay, and growth failure. Uniquely, our patient presented with a novel, likely pathogenic variant and had vision potential in the microphthalmic eye. With amblyopia therapy and customized clear conformer use with serial fittings, she has developed meaningful vision. Her best corrected vision was 20/250 and symmetrical orbital growth. The child has motor and fine motor developmental delays and is currently doing physical and occupational therapies. In conclusion, patients with SOX2 associated disorders frequently exhibit both ophthalmic and systemic manifestations. Ocular findings are often bilateral but can be asymmetric. However, in this case, the left eye was normal. This case illustrates the importance of pursuing a genetic workup in a patient with unilateral disease and evaluating for systemic manifestations. Initially advised to use an opaque conformer, the clear conformer and amblyopia treatment have enabled functional vision in this patient. Thank you so much.